8,500 extra mental health workers. That was one of the government's flagship NHS pledges, and it was meant to take an entire parliament to deliver. Instead, on the 30th of April 2026, ministers confirmed the target had already been hit, roughly 3 years early. It is a rare piece of unambiguous good news for a health service that has spent years under intense strain, and it lands at a moment when demand for mental health support in the UK has never been higher. Today, on the 4th of July 2026, those new staff are already working across NHS services, from talking therapies to crisis teams. In this video, we will look at exactly what was promised, how the recruitment drive got there so quickly, what it actually means if you or someone you know is waiting for support, and where the government plans to go next. The pledge to recruit 8,500 additional mental health workers was a manifesto commitment made before the 2024 general election, and it was framed as a response to a system visibly buckling under demand. Crucially, the promise covered the full breadth of the mental health workforce, not just psychiatrists and psychologists. It includes therapists delivering talking therapies, mental health nurses, support workers and staff embedded in crisis and community services. The original timetable gave the government until the end of the parliament to deliver, which made the announcement on the 30th of April 2026 genuinely striking. The health secretary confirmed the figure had been reached with years to spare, and coverage across outlets from Gov.K to LBC, and the National Health Executive described it as a key national target met ahead of time. In a policy area where missed deadlines are the norm, an early delivery stands out. This did not happen overnight. The groundwork was laid through 2025, when the government announced in June of that year that thousands of extra mental health staff were already being brought into the NHS. That earlier boost signaled the recruitment machine was moving faster than expected. By spring 2026, the cumulative numbers crossed the 8,500 threshold, and the confirmation followed at the end of April. Reaching the figure early matters for a practical reason: recruitment is only the first step. New staff need training, supervision, and time to embed within teams before patients feel the full benefit. Hitting the headline number in 2026 rather than 2029 means that bedding in process is happening now, while the Parliament still has years to run. It also frees political attention to shift from counting heads to the harder question of whether services are actually improving on the ground. The workforce announcement was quickly followed by something bigger. On the 15th of May 2026, the government launched a review to develop a new national mental health strategy, described as an effort to transform mental health care in England. The sequencing is deliberate. Having secured the staff, ministers now want a plan for how those people are deployed, and the review is expected to look at how services join up across the NHS, schools, and communities. Pharmacy business and other health sector outlets reported the launch in mid-May, noting that the strategy review would examine the system as a whole rather than tinkering at the edges. For campaigners who have long argued that mental health receives a fraction of the attention given to physical health, the combination of an early workforce win and a full strategic review represents the most significant policy moment in years. So what changes if you are actually waiting for help? The honest answer is that 8,500 extra workers expand capacity across the system, and capacity is the single biggest constraint on mental health care. More therapists means more appointments available through NHS talking therapies. More mental health nurses and support workers means crisis teams and community services can see more people, sooner. Waiting lists for mental health treatment in England have run into the hundreds of thousands, and while extra staff will not clear them instantly, they are the only sustainable way to bring waits down. There is also a quality dimension. Overstretched teams cancel appointments, rush assessments, and burn out. Better staffed services can offer continuity, seeing the same clinician across a course of treatment, which the evidence consistently shows improves outcomes. The effect will build gradually through 2026 and beyond, but the direction of travel is finally positive. None of this is happening in a vacuum, and the scale of the underlying crisis was laid bare just weeks after the recruitment announcement. On the 20th of May 2026, reports revealed that around 500,000 young people had turned up at accident and emergency departments amid the mental health crisis, with campaigners saying young people had been, in their words, unforgivably failed. Think about what that number means. A&E is the last resort, the place people go when there is nowhere else. 500,000 young people arriving at emergency departments points to a generation unable to access timely community support. It is precisely this pattern the new workforce is meant to break, by catching problems earlier, in schools, GP surgeries and community hubs, before they escalate into emergencies. The 8,500 figure is an achievement, but that A&E statistic is the sobering measure of how far there is to go. Looking ahead from July 2026, 3 things are worth watching. First, the Mental Health Strategy Review launched in May is expected to produce concrete proposals, and the choices it makes about children's services, crisis care, and community provision will shape the next decade. Second, retention now matters as much as recruitment. Hitting 8,500 means little if experienced staff leave as fast as new ones arrive, so pay, workload and career progression across the mental health workforce will come under scrutiny. Third, expect the government to keep leaning on this success politically. Health delivery is central to its pitch to voters, and a target hit early is a story ministers will want to repeat. The test that really counts, though, is measurable: shorter waiting times, fewer young people in A&E, and more people treated close to home. Those numbers, not the recruitment tally, will define whether this moment was a turning point. Here is the bottom line. On the 30th of April 2026, the government confirmed that 8,500 extra mental health workers had been recruited into the NHS, delivering a full manifesto pledge years ahead of schedule. It was followed within weeks by the launch of a new national mental health strategy on the 15th of May. Together, they mark the most substantial investment in mental health staffing England has seen in years. But the 500,000 young people arriving at A&E in crisis is a reminder that recruitment is the start, not the finish. The real measure of success will be felt in waiting rooms and communities over the months ahead. If this topic matters to you, keep an eye on the strategy review as it develops, and remember that if you are struggling, NHS talking therapies can be accessed directly without a GP referral. Thanks for watching.